Hello, Orchard Hill students. I'm Dr. Aaron McMichael. I'm a DC or Doctor of Chiropractic, and I live in North Canton just like you. You may even know one of my kids in 4th grade at Orchard Hill, Oscar McMichael. Hey, Oscar. Well, you're learning very important information today as part of Red Ribbon Week, and I've got a special message for you because I'm drug-free, and I want you to be drug-free too. Will you join me? I'm part of a group called the Stark County Opiate and Addiction Task Force. This group was started a few years back because so many people in our area were getting hurt from drugs and even dying sometimes. These dangerous drugs are called opioids. 112 people in our county have already died from opioids this year. We're working hard to fix this, but we need your help. Please help us. But first, let me tell you a story about a boy who lived in our area. His name was Tyler. Tyler was active and healthy growing up. He loved sports and played baseball, soccer, football, and golf. But with sports came injuries. He got hurt. And by the time he was 18, Tyler had 2 major surgeries on his right elbow. Each one sent him home with medication to help block his pain and try to make him feel better. The medication covered up his pain, but didn't fix his problem. So he wanted more. When you start taking more and more, opiates become very dangerous, and Tyler became addicted. He couldn't stop taking the medications. He tried getting treatment, but it was too late. Tyler died of a drug overdose at the age of 23. His parents were so sad they started a local organization around here to help others like Tyler so that other families don't get hurt by drugs too. They never thought it could happen to their son, but it can happen to anyone. So we all have to be careful. Now, what's important to understand from this story is Tyler wasn't a bad kid. He didn't start out by doing bad things and hanging out with bad people. He was a good kid, but he was injured from sports. He wanted help to fix his problem, so he went to a doctor. A lot of people who've been hurt by drugs started with a painful injury. Have any of you been injured playing sports, or maybe just playing around your house? My son Oscar, a few years ago, he was playing with his brother in the backyard and broke his arm. We had to take him into a doctor to put a cast on it to try to heal it up for him. Injuries can really hurt and cause a lot of pain, can't they? That doesn't feel good. But in recent years, some doctors have made the mistake of giving too many opioid drugs to treat pain. Now we know these drugs are dangerous and should only be used a tiny bit for really bad problems. So what could Tyler and his parents have done differently? Now we know it's best to start without drugs or surgery first, whenever possible. So what are some of the things we can do when we're hurting? Well, number one is using ice or heat. A pack of ice or a hot pack can help reduce pain and relax your body so it feels better. Ice is one of the best first things to try if you're hurt. Wrap ice in a towel and then cover the spot that hurts for about 10 to 20 minutes. Another thing you can try is gentle stretches. Nice, easy movements often help the area feel better and heal up faster. Rest is often helpful. Sometimes you just need to give your injury a chance to heal for a day or two. Sleep is very important because it's when the body does most of its healing. Chiropractic adjusting. At our clinic, we work hands-on to make the joints and muscles move better so they feel better and work better. Massage. Rubbing the muscles can help relax them and reduce your pain. Acupuncture. This is when you use tiny little needles in the muscle that tell it to heal up. Therapies. This includes exercises and other drug-free therapies that can help get the body moving better and feeling better. I think you've done some yoga classes there at Orchard Hill. Yoga is a great way to exercise and feel better. Nutrition. Eat lots of veggies, don't forget them, and drink plenty of water. Make sure you eat real food and avoid the sugary junk food. Medical experts recommend that even common medications from the store like Tylenol or ibuprofen not be used first for injuries, because these drugs carry risk too. try drug-free options first. Then medications can be tried if needed for more severe pains. But never try any medication without your parents knowing. So what else can you do to be drug-free? Just be your healthiest. A lot of what I mentioned today isn't just good to fix an injury, but also great to keep you healthy as well. The healthier you are, the better you'll feel, and the less likely you are to be injured and need drugs. So here's my final tips for you. Eat healthy, drink water. Eat lots of good veggies, lots of real foods. Avoid that junk. And water is the best drink in the world. Make sure you're getting plenty of water in each day. Stay active and sleep well. Get outside, get moving, have fun with your friends, do what you enjoy, whatever sport or healthy activity that is, go outside and have fun. And don't forget to get your rest. We got to get plenty of sleep to let our body heal up from everything we throw at it each day. Sit and stand straight. No slouchers. I see you slouching. Now let's try this. You're a puppet. You got a string attached to the top of your head. Check it. Is it attached? Yep, mine's attached. All right. With me now. We're going to pull it up. Here we go. Here we go. Okay, now I'm sitting nice and straight. And with better posture, I'm going to feel better and I'm going to avoid further injuries. And lastly, be positive. I hear you guys have been doing great with this one at Orchard Hill. If you see a classmate that needs some help, give them a hand. It will make you and him feel better. Well, that's all I have for now. Thank you for inviting me to join you today. With your help, we can make ourselves, our families, our friends, and our whole community healthier. Do you know what drug-free looks like? Drug-free looks like me. Because I choose to be healthy without drugs, and I hope you do too. Now have a great day.